myself Shaista Malik. In previous session, we talk about the cognitive behavior therapies and how we are implementing cognitive behavior therapies in challenging our irrational thought pattern or challenging our irrational thought pattern. So today we are starting our session by types of CBT and techniques used in CBT. As you people can see in the slide, there are many types of CBT, but today we are discussing about only 4 types of CBT, that is the REBT, DBT, MBCT and ECT, and what are the techniques we are using in particular kind of CBT. So as you can see, rational emotive behavior therapy is a type of cognitive therapy who first used by Albert Ellis. The goal of this therapy is to challenge your irrational beliefs in a more rationalized ones. So how it works? ABC. What is ABC model? A represents to the activating event, B to the belief, and C to the consequences. So REBT focus on identifying irrational beliefs that lead to emotional distress. Let us understand with an example. A student thinks, if I fail once, I am a total failure in life. REBT teaches to dispute these irrational thoughts and develop rational themselves or rational alternatives. So it uses the ABC model as I described. By modifying B, that is the belief, we change C. C is the consequence. So what we have to do? We have to modify our beliefs so that we can change the consequence. As you can see in this slide, activating event happen. You think in a certain way and the consequences will be the emotional response of your thoughts. But what if you can replace those irrational beliefs with the more rationalized one? Then the emotional response will be more helpful, or you can say more better. E reflects to the effective new beliefs replace the irrational ones, and D to the disputations to challenge irrational beliefs. So this is how ABCDE model works of dialectic behavior. ABCDE model works for REBT therapy. Now we are moving towards cognitive distortions. So just take a quick look for cognitive distortions. What are cognitive distortions? Beck gave some types of cognitive distortions. What is arbitrary inference? That we are drawing conclusion on the basis of the insufficient and irrelevant evidence. Selective abstraction, we are focusing on a single expectant situation and ignoring the others. Magnification and minimization is related with the selective abstraction, as we are magnifying some undesirable events and we are minimizing the significant event. Overgeneralization is drawing broad negative conclusions on the basis of a single insignificant event. Personalization, attributing the negative feelings of others to yourself, that I am the victim, I am the responsible for everything happening in my life, this way. So differences, what is differences? Albert Ellis views that therapist as a teacher does not think that a warm personal relationship with a client is essential to treat a patient. In contrast, Beck stresses the quality of a therapeutic relationship. So REBT uses different methods to depending on the personality of the client. In Beck's cognitive therapy, the method is based upon a particular disorder. So let us discuss about other therapies, then we'll proceed toward the how we are using these therapies in treating different kind of disorders. let's discuss about dialectic behavior therapy. So dialectic behavior therapy was first introduced by Marshall Ingham, which is particularly helpful for intense emotions, self-harm tendencies, suicidal thoughts, and borderline personality disorders. So this therapy works on some techniques. It balances our acceptance plus change and focuses on mindfulness, distress tolerance, emotional regulation, and interpersonal effectiveness. As we can see in more academic terms, dialectic can be summarized as thesis, antithesis, and synthesis. The process makes three basic assumptions. What are these three basic assumptions? All things are interconnected. Change is constant and inevitable. Opposites can be integrated to form a closer approximation of the truth. So when we are treating a patient of DBT, a patient and therapist work to resolve the apparent contradiction between self-acceptance and change to bring about more positive changes in the patients. So DBT teaches individual how to tolerate your emotional pain and build healthy relationships. That is, build healthy interpersonal relationships. In this slide, I summarize the whole DBT sessions. Like it started with the mindfulness, that being aware of the present moment and being non-judgmental to your thoughts and emotions. Then how you have to regulate your emotions, that is the vulnerability emotions, changing unwanted emotions, how you have to tolerate the distress, that is if we thought in crisis situations without making things worse and accepting reality as it is, we can change our interpersonal effectiveness, that is the increasing in self-respect and relationships. So let's move towards the mindfulness based therapy. Mindfulness-based therapy is a combination of mindfulness plus CBT. As we discussed in the previous DBT session, slide, that mindfulness is the acceptance of present and being non-judgmental towards your thoughts. So mindfulness helps people become aware of the present moment rather than being stuck in negative automatic thoughts, past memories, future worries. So MBCT encourages acceptance, self-compassion, and living in the here and now. How we can do this kind of mindfulness? The meditation is the best way to accept yourself and to change your negative thoughts, to release your unnecessary, unwanted thoughts from your mind. So it is a seated meditation technique that focuses upon attention on breathing, bodily sensation, and mental relaxation. Here you can see in this slide, it is described in a very well manner that how you have to start step by step and how you have to proceed. So the mental benefits of mindfulness you will get, you can fight PTSD, you can fight depression, you can fight anxiety, you can fight memory loss, and you can help yourself to regulate your emotions in a better way. So nowadays, mindfulness based therapy are trending. Why? Because it is giving you dual benefit, changing your thought pattern also and giving a lot of benefits to your body also. What kind of benefit it can be? Reduces arthritis, reduces heart disease risk, help irritable bowel movement, fight chronic pain, slows HIV progression, aids in weight loss, helps cold and flu effects, and the best effect of mindfulness is improves your sleep. You can sleep better. If you practice mindfulness, you will see a lot of changes in your body and mind. So mindfulness based therapy plus CBT, when it combines, we call mindfulness based cognitive therapy. So as we discussed, ABCD we are using ABCDE model we are using for REBT. DBT is to challenge your disputation. Mindfulness is to know more about your body and then challenge the disputation. Let's discuss about the action and commitment based therapy, or you can say the acceptance and commitment based therapy. This image I found really cute and helps you to understand better what is acceptance, because the ACT, that is the acceptance and commitment therapy, is completely based upon your acceptance. So let's just take a quick view. What is ACT? Then I will explain this picture to you. ACT teaches that struggling with thoughts often makes them stronger. That is, instead of avoiding something, you can challenge and you can face your fears. Instead of trying to eliminate negative thoughts, ACT focus on acceptance, psychological flexibility, value-based actions. A key idea in ACT is you don't have to believe every thought your mind creates. Techniques like cognitive diffusion help individual detach from unhelpful thoughts. That is, every idea coming in your mind is not true. You better have to discriminate between what is right, what is wrong, what I have to put inside my head, and what I have to get out from. So let's discuss about this picture. As you people are seeing, the child is afraid of this dinosaur, or you can say a puppet dinosaur. But child acknowledge that fear and ask that fear is okay. Instead of afraiding from you, just come in. I will allow you to come in. And when that fear come in, the child accommodate that fear. That is okay. We can be friends. Or if I need you, you can help me. So this way you can challenge your irrational thought pattern and false belief and make it in a more acceptable way, that okay, what is needed I will keep, and what are the disputation I am having in my mind which is not serving me anymore, I can throw it out. Instead of avoiding those things, or instead of avoiding those things to come in your conscious, you can deliberately face those fears. This is your window of tolerance. You can see that hyperarousal, point of overwhelm. Then optimal window of tolerance is the regulation escalation trigger. Now you are feeling okay. So hyperarousal doesn't mean that every time you have to be coming in the overwhelming situation. You can regulate those fears and you can escalate those triggers. So the consequences you face is the comfort and something sweet if you are working enough for your cognitive distortions. Now in this picture, let's take a look about auto CBT procedure, how the topology of CBT works between a user and a counselor. So as it mentioned, overview of this auto CBT framework. Upon receiving a user's question, the counselor first uses dynamic routine to determine whether to consult a supervisor or respond directly to the user. For today's sessions, I am just summarizing the entire session here. The CBT is based on the connection between thoughts, emotions and behavior, as we discussed in previous lessons. So there are multiple types of CBT. Today we discussed about REBT, focuses on irrational beliefs. DBT helps in regulating intense emotions. MBCT blends mindfulness and cognitive work. ACT promotes acceptance and flexibility. And what are the techniques these therapies using? That is the ABC model used by REBT, mindfulness by MBCT, cognitive diffusions by DBT, and bring long-lasting positive changes used by ACT, that is the acceptance and commitment. So at the end, I just want to say to you that CBT empowers individuals to take charge of their thoughts and make healthier decisions and enhance their quality of life. So I am ending this session. Goodbye to you all. We'll meet in the lesson 4.